Good afternoon, and welcome, and thank you for joining us for an hour this afternoon for our 5th virtual donor briefing. Today's topic will cover the COVID-19 pandemic and the relationship and profound impact on mental health. This program was established prior to the horrific events taking place in our country. We will touch on the current situation during the conversation. Related to this, hopefully you read the Community Foundation communication sent out by email mid-afternoon yesterday. It was a letter from our board chair, Dr. Kalila Brown-Dean, vice chair, the Honorable Fleming Norcott, and our CEO, Will Ginsberg. It's a call to community. We encourage you to join us by listening, learning, leveraging, and leading. When you have time, please read the entire letter. We welcome your comments, feedback, and dedicated action along with us. We are deeply grateful to today's panel. Foundation board member, Dr. Maysa Akbar, will introduce our speakers and lead today's conversation. Before I turn it over to Maysa, I just want to give you a few housekeeping items. We welcome your questions. We're going to leave time at the end for a question and answer conversation. And during the conversation, please feel free to type in your question in the Q&A box and hit enter, and it'll be monitored by us. And we will get to as many questions as we can, and anything we don't get to, we will try to respond to you in our overall summary of the event. If you have any technology problems, there's the chat box, so please use that. And then at the end, we always welcome your feedback, and we have a quick evaluation. All right, I will turn the program over to Maysa. Thank you.
Thank you so much, Dottie, and everyone from the Community Foundation who is supporting this convening and this briefing. It is so essential in these times to have open dialogue with the New Haven County and greater New Haven community about what is going on in our world. I'm going to begin by introducing myself, then introducing the rest of the panel, Dr. Alice Forrester and Reverend Frederick Streets, and allowing them some time to introduce who they are. As Dottie mentioned, I am currently one of the foundation board members. I'm also a clinical psychologist and the founder and owner of Integrated Wellness Group, which is a behavioral health practice that primarily focuses on culturally diverse interventions, race-based trauma, and caring for communities of color. I'm also the author of a book entitled Urban Trauma, A Legacy of Racism, which there has been no other time more than the present where the relevance of urban and race-based trauma has come to light. I am grateful to be able to have these esteemed colleagues with me today to have a very deep conversation, not just about what's happening related to COVID, but we could not move past this opportunity without also paying very close attention with what's happening in our society and the pain that historical structural racism has caused many of our American citizens. So I'd like to start with Dr. Alice Forrester for her to introduce herself, and then Dr. Reverend Street. Unmute yourself, Alice. There you go.
Thank you, Dr. Akbar. I'm so appreciative of your words, and you're exactly right. There's no way to not bring this conversation really to structural racism You know, it's something, I'm the CEO of Clifford Bears Clinic, and, you know, we're 107 years old, and our founder tried to change the world for people around mental health. He was a patient himself, and really fought till his death in the 40s to create advocacy and federal law to change so that mental health could occur in the communities and not locked away in insane asylums. And so with this legacy, Clifford Beers has always been looking at what are the barriers to care and how can we you know, contribute and advocate for our families in a way where they can receive mental health services, not in the traditional sort of very privileged hour sessions, but, you know, have it delivered in alternative ways. And it's an uphill battle, but one we are very continue to try to explore.
Thank you. Reverend Streets?
Hi, I'm delighted to join with the rest of my colleagues, and thanks to the Community Foundation. My name is Jerry Streets. I'm the senior pastor of the Dixwell Avenue Congregational United Church of Christ in New Haven. Dixwell Congregational Church was founded in New Haven in 1820, and so it is celebrating its 200th year. The long history of social activism and social justice work in the greater New Haven community. I'm also a clinical social worker and a member of the faculty at Yale Divinity School, and a member of the ambassador board at the Community Foundation.
Wonderful. You know, I sent out an email to you guys last night, and I said, boy, 2020 really started us off on a path of either mass destruction or it positioned its own call to action about significant change that has to happen both in our society and in our world. And I think for many of us, it's shaken us to the core, whether it's from businesses to unemployment, to food insecurities, to health disparities related to COVID, and most recently, with all of the disturbing images around racial inequities. And I thought about, when I was thinking about this conversation, I was sort of thinking about a theme that, you know, like, what is the theme? What is 2020 trying to tell me, right? I try to be reflective from that perspective. And the word that kept kind of like creeping into my mind was the thought of breath. Let me explain what I mean by that. I was thinking the havoc that COVID has created in the human body is the idea that it collapses your lungs. It takes away breath. And ultimately, if not vented correctly, if not given the right amount of oxygen, it would also take your life. When I think about George Floyd's life, and I think about what he was screaming and asking for, it was breath, and what ultimately took his life. And when I think about what the protesters are saying and what we're needing, is that we need to breathe. We need to breathe. And I want to talk about that because while it is a demonstration of the physical manifestation of what we need to survive, the other piece of that is what it's doing to us mentally. So let's first start with an identification of the mental health impacts that COVID is having in the communities that you serve. So Alice, for you, it's people that are coming to your practice, to Clifford Beers, to seek treatment for their children, their families, to get supportive services in a number of different ways. Jerry, for you, it's those that are seeking refuge in the faith-based community, perhaps have a social justice agenda just as well, and you're having to guide and lead that call. So let's start there. Alice, what are your thoughts about how if we think about this from the representation of breath, right? I can't breathe. What has COVID meant to the communities that you serve?
Yeah. That's a really good metaphor, I think, for the struggle, right? I can't catch my breath is a common theme we hear from our families. I can't catch a break. I work 3 jobs. I'm, my son's, not going to school. I don't have enough food. It's the end of the month. I can't catch a break. My car won't start. This idea of breath, and when you think about trauma and healing from trauma, you really look at trying to help kids and families like create a space for breath, right? To create a space to ground or think before you act, right? Because trauma just fills us with these, incredible amount of anger and rage and reactive hypervigilance. So breath is a really important, I think it's a deep image. And so I think that for our families and for our agency, within 5 days, we went up to be a virtual telehealth. I'm sure you did too. It's sort of like, okay, we have to turn the whole company around and everybody's working from home, and, maybe 1 or 2 people in the office, for, safety's sake or whatever. But in general, we went to the phones. And, we managed to connect with a large group of our families, but not all of them. And so many of our families are even just missing the technology, iPhone or a device to be able to communicate, let alone for therapy, but for education, and so, there's another can't catch a break. The other thing that, we were prepared for, but really moved by, is the enormous need for food and for basic needs. We've had a lot of donors give money directly for like gift cards and, ways to buy, to buy necessities. But New Haven has been incredible in terms of a food distribution network. But boy, if you go to another town, that's, not the case. And so, how do you sleep at night when you're worried? I mean, I've got 3 kids and they eat me out of house and home. Now they're home 3 meals a day.
Right.
We don't have the space and the move just for that. So I guess breath to me is, I can't catch my breath because one thing on top of another. And, finally, the privilege I have as a white woman, although I'm raising Black children, the privilege is that I don't have to worry every minute of the day about walking outside or my job in a way. And it's just raised the consciousness of privilege, that I have, that I can work from home, So, and I, every time I go to the grocery store, every time I have someone who's served us, the gratitude I feel for them, and they're not breathing well, like that's the feeling that is they're breathless because it's so scary. Fear makes you breathless too.
Yeah.
I'm sorry if I went on too long, but
no, I think that's so powerful, right? That the other side of trauma, and one of the ways in which, we're taught and we teach to manage the anxiety that comes as a result of the trauma is to anchor ourselves in our breath. That's why things like meditation and yoga are so important. Jerry, what are your thoughts about this? How from the perspective of not just being a leader in the faith-based community, but also a clinician that gets this and understands this, and a warrior for social justice, what impact have you seen in the communities that you're in, and what are they crying out for? What are they saying to you that they're needing right now?
Well, as we all know, a crisis reveals the strengths and weaknesses of any system, um, social systems, economic, political, and certainly our own biological systems. And so when I've asked myself the question, what is different about this time of racial oppression of African Americans since I experienced coming here relatively in 1619?
Mm.
And there are some similarities, but there are also one or two differences that makes this uh, experience of COVID and racism manifest themselves in even a more pronounced way in the people that I talk to and try to help. The way that it is no different is that we know from 1619 onward, the Black community has experienced uh, oppression and murders and hangings and all kinds of atrocities. Um, what's different about this now is that we're in a global context whereby very few places outside of one's own community or family feel safe. So every aspect of human life is threatened. It's one thing to be in a community and a family system that is coping with all kinds of pressures, and then that individual, those people in those communities, that family, reaches out to the wider community for help. In this situation, the wider community too, broadly speaking, is feeling vulnerable, afraid, victimized by COVID, and I think this is opening up a potential deeper sense of collective empathy that can drive more of a honest coalition between communities of color and the larger society, because there is this now breaking open of a sense of vulnerability that was once experienced more acutely or perceived to be the problem of one particular sector of society.
Mhm.
And so as I think about this, I also know that people rely on their faith, whatever or faith orientation that might be, for a sense of strength and from their fellowship in their church or mosque or synagogue or temple. And while we have gone to virtual worship in our church, like a lot of churches and other faith congregations, we've had to engage as all the media, social media platforms to help people to still feel connected and have a sense of community. So that is one of the challenges that we're trying to meet. But I also think that I've kind of I describe once this acute phase of the racial and pandemic crisis subsides, I think in the long term, the effect on people will manifest itself as what I describe as a chronic racism stress affliction response, a chronic racism stress affliction response. That is the ways by which people of color and those who have been advocates for them and for justice have to cope with and constantly deal with messages and images and being treated inhumanely, and even being ridiculed and rejected if you're not a member of a community of color. If you're a white person, you can have the negative impact of people's response to your support. So I think this is going to evidence itself in all kinds of social and mental health and physical indices of care as we move forward. It's not just that the Black community will need to dig deeper into its traditions of faith, but it needs to also feel that there are corrections in the larger society. and in the larger institutions that affect our common life. Otherwise, you live in this tension of trying to get stronger, but yet dealing in an environment that is constantly negating you. So it's a combination of the two, and not just individual resilience. It's both individual and communal and societal resilience. And this has manifested itself in some people with whom I've been working, really struggling with trying to figure out how they're going to discern the meaning for their life. Now, I have a very simple, it's more complex, of course, but a simple way of talking about spirituality, because I see this fundamental spiritual quest of all of us is, how do we make meaning out of our life? And how do we feel that we're part of something bigger than ourselves? And so when the social structures and support external to a community of color, as well as some of the factors within that community are decimated or minimized, it can create a spiritual crisis for people, because they ask, why is God allowing this to happen, or however way they understand God. What does it mean to be faithful? Here we are 400 years later, and we're still witnessing different modern forms of lynchings and murder and hatred of Black people. What is it all about? And so it's this quest to discern and create a life of meaning in the midst of being particularly targeted, but also living in a society and a world that feels also more vulnerable than it's ever felt before, at least in my lifetime.
Let me ask a question related to that, because I think that this is so important. There are so many of us, and possibly people even in the audience, who might feel, that they're either, in an essential worker position in the front lines, supporting organizations that are triaging these types of situations from a vast majority of what we've discussed in terms of the greater need. What recommendation would both of you had? I always think about, like, who heals the healer, right? Like, and I think that there are so many right now that are positioned, giving the layers of crises, because it's not just one. It's like one layer on top of another, on top of another. I mean, talk about, like, a demonstration of complex trauma. Even those that sort of are absent of environmental toxic stress, or have been positioned not to necessarily experience these types of traumas, whether vicariously or through, through direct contact, direct victimhood of those traumas, they are experiencing significant levels of mental health, I think of compromised mental health. What recommendation would you give to those folks that still have to wake up every single day and go to the grocery store and make sure they're at the checkout counter, who still have to wake up every single day and triage the patient that's coming in via emergency, EMT into the ER, who still have to wake up every day and manage a case of child abuse and neglect, regardless of what's happening, at this point, who still have to wake up every day and drive the buses or the public transportation to make sure that people are getting to where they need to go. Where would you even begin in helping them to understand how to start to take care of themselves through this process? Alice, do you want to take that, or Jerry?
Can you hear me okay? Yeah.
There's a little loop back.
Okay. Can you hear me okay now? Yeah. And Jerry, you're going to be much better at talking about the the self-care. It was interesting. The woman who checked me out on Saturday at Stop and Shop looked exhausted. And she had on her name tag, her name, and underneath just a piece of tape, and it said, "I can't breathe," right? And I said to her, as I have, thank you so much for working and being here. And she said, yeah, it's just crazy though. I have to work so many hours because there aren't enough people to work, right? So she said, I'm putting in a 12-hour shift today. And that was like, I wanted to go to the manager and say, for God's sake, how, you can't do this to people. You can't make them do 12 hours and then expect them to come back the next day, because it's just so overwhelming. And, Maysa, I think, you and I both run organizations, right? And I can't run my organization unless there's patient fees being, generated. I can't pay people unless the contracts are followed and things like that. And so the business pressure to just keep going sometimes takes precedence, unfortunately and horribly, over the self-care, right? We had a leadership meeting this morning. How do you, give a message like, we're going to give everyone a day off. Well, now they know, but on Juneteenth, right? And so, but that's a double message, right? Hey, make your billables, but we're going to give you time off. We gave everyone 2 weeks of COVID time so that they could manage and figure it out. But that is this fiscal year, because this fiscal year has gone to hell. When the new one starts in July, it's going to be, we're going to have to be up and running. And so I think that is a continual tenuous balance, and throwing some mindfulness classes or self-care classes are okay. Mm-hmm. But as a business owner, or, trying to get, as a doctor going into work, it's very hard, and it's a very real pressure. So thank you for mentioning that.
Yeah, and you're even bringing up, I think, such an important idea, right? Like, as a business owners, how many restaurant owners had to make decisions about, what they were going to do to deal with the closing down of their businesses. How many hair salons and, nail salons and spas and these other businesses that depend on a foot flow of people coming in order for them to survive. And then another sort of arena where the racial inequities were demonstrated was that when this, the governmental PPP came out, then you saw again the disparities in terms of who were issued these funds, what amounts were given to different corporations, and how many small minority, women-owned, veteran-owned businesses were left out of that process. And so, Jerry, as you said, this is sort of like, it is not just a spiritual crisis. I mentioned to somebody the other day that this is probably the biggest existential crisis that we have had in our lifetime, and that folks are hitting a breaking point that they don't even know what to do, and if we capture this, Jerry, as a catalyst event, and you mentioned sort of like, let's date back to 1619, or some theorists would say even before that, before, Jamestown, before Point Comfort, whoever argues sort of like where the point of origination was. And we take it generation by generation as the different iterations of racism has shown itself through Jim Crow, through segregation, through lynchings, through mass incarceration. How do we, how do Black folks, how do the Black community, I want to sparse this question out because I think it's essential. First, how does the Black community practice self-care while advocating for their rights? Second, how do folks that identify as within the umbrella of POCs support this movement? And then how do allies contribute to this in a productive way? I know that's loaded.
Well, no.
But help me out.
For some, maybe more than some, advocacy is a form of self-care. It's not a separate activity. It's
one or the other, right?
It's a way of being in the world, affirming one's sense of dignity and care for self as well as others. I've been impressed and grateful for members of my congregation, like members of other faith communities who have been providing food, masks, COVID-19 information, and other kinds of care strategies to other church members and members of the wider community. And what this reminds me of is that particularly within the African American history, Black people have always sought to help other people, particularly members of their own community, while coping with their own stress. And so when I talk with people, I help them or try to reflect with them on what are their social support systems of family and friends, and what is their own history of facing past challenges, and how did they deal with them at that point, and can they draw a sense of strength from that history as well as from their faith if they are faith oriented. So helping people to think about that has been important, but also what's going to be needed even more so moving forward is that we have to provide safe spaces and platforms for people to share their stories and to express their feelings and to learn more ways to practice physical, spiritual, and emotional self-care practices. And so it's acknowledging, helping people to tell their stories, acknowledging the stress that they're under, at the same time identifying how they have historically and how they're currently dealing with the stress, and giving them other things to think about, strategies and ways to self-monitor and to be aware of how they need to balance their caring with advocacy, but also to help them to realize that self-care is not selfishness.
So let me just try to understand. So I want to make sure that for, let's say, a person that hasn't figured out a good way to self-care, if putting thought to action is a way that I can take care of that I find an appropriate way to cope and direct my energy, right? I would say that's pretty adaptive, because there are other, of course, very maladaptive ways that we cope with stress and trauma.
Right.
Then where would you suggest that they begin? Alice, what's a first step? Let's just call it sort of like a first step. Jerry, what's a second step? Let's make it simple and concrete.
So what is the simple and concrete you want to make?
Yes.
No, I mean, what's the question before that?
So what if advocacy, if I have found, okay, a way to self-care is advocacy, and advocacy means channeling my energy into something that matters to me. For some of us, maybe in joining the protesting rallies. For some of us, it may be making masks. For some of us, maybe distributing food. How then, at the same time, because we are still being exposed to all of the different layers of traumatic experiences that our bodies are inputting, how do we counterbalance that advocacy with a healthy way to take care of ourselves? And I'm asking for a very practical solution, like first step.
Where awareness of how what they're doing is impacting them physically and emotionally. So people would have to take time to be reflective and to recognize that sometimes even in the advocacy work, it might be an avoidance of other self-care work that they need to do to balance off. So it's that process of helping them to be more aware. And that means a kind of, as you know, in our clinical world, all counseling and therapy is a form of psychosocial education. So we have to help people to think about or have frameworks, whether they agree or disagree, but at least to think about how they understand stress. And I do a lot of visual aids about how stress works in the body. And when people see that and I walk them through it, they say, oh, that's what that is, So now what do you do when, how do you minimize triggers, and how do you understand triggers in your own life? As much as you may need to and want to be informed, how much do you really need to look at TV and all the reports day in and day out.
Yeah.
And I've heard people say that they can't watch, the video, which is understandable, of Mr. Floyd. But when other triggers come, how do you understand triggers? And then how do you moderate those triggers? And how do you understand how triggers can influence you to make decisions and kind of be unconsciously aware that that's what's influencing you?
That's
So
right.
that kind of self-aware, a biosocial, spiritual self-awareness is so important.
I love that. Alice, what are your thoughts?
I would absolutely agree, Jerry. You said almost everything I would say, but I think even more concrete is water, sleep, right? Acknowledging what you're feeling, and that does take some psychosocial awareness, but really being very attentive to those feelings, and turn off the TV or turn off the social media so that you don't, like Jerry said, get triggered. And I think, it reminds me a lot of the process of grief, right? And this idea that anything you're feeling right now is normal, right? To not get caught up in, oh gosh, I'm having these feelings and that's not right and something's wrong with me or whatever, that, there is a time right now, if there is ever a time right now, that any feelings are okay, and acknowledging them. You don't have to always act on them, but just to recognize that this is really, like you said, Maysa, an existential crisis that we've never seen, and who knows what's coming around the corner.
Yeah.
But also to help people, I agree, to normalize their reactions, that some of which they may feel guilty about having, and letting them know that they're not going insane. They're normal. This is a normal reaction. You're not crazy because you feel upset. You're not crazy because you are stressed out. We can add all the stems to that, but to help people, like you said, Alice, to recognize that what you're experiencing is normal. How are you aware of its impact on your life and on your decision making? And to remind people that no matter how difficult the situation is, there's always some element of self-agency, that you're not totally helpless, and help people to identify those areas that they can take charge of and move forward with, which often means letting go of a lot of stuff too.
Right. I'm going to ask one final question and then open it up to the Q&A. And this one is a question. We've talked a lot about how to support, people that are essential, that are working in the front lines during COVID. We've talked a lot about, what happens to the Black community and POCs as they're dealing with sort of racial inequities. But I want to take it to sort of an area that is often missed in this conversation, which is, how do white folks who are, either in a position to support or in a position where they're not in agreement, how do we contextualize and understand dealing with that? We have a very divisive political climate. There are different messages that are coming that can be very emotionally destructive. Certainly there are messages that are sometimes given that invalidate the importance of creating an equitable world. And I want to talk about, how do we deal with that subset of the population that is not getting it, or that is not pro this type of, it's important that we unpack all aspects of this, right? Because mental health is a very dynamic thing. And while I want to make sure that it's a brief response so we can get to some of the Q&A, if you both had a statement on that, where do we begin to unpack that piece of it that is often unspoken?
I encourage people, Black and white, borrowing from the works of a dear friend and mentor of mine whose name was Howard Thurman, I encourage people to really examine what they're afraid of, the source of that fear. I help them, encourage them to examine their sense of deception about who they are and who other people are, and how those combinations of false identities of self and others and their fears of other people based on those false identities leads to and reinforces hatred. And hatred of others, and in the case of some people who are oppressed, even self-hatred. So I know this may sound more, reflective and cognitive, but at the deeper emotional, spiritual level where people are living, they are really living out their fears, deceptions, and hatreds. And so I think white Americans need to take a serious look at those dimensions in their own life. And I know that there's a different view, as you said, about politics, but they need to understand that a lot of people perceive the current leadership of our country as promoting a white nationalist agenda. And what white people need to understand, that agenda, if it is true, that agenda defines who is white, who is Christian, who is male, and who is female. And when you really drill down on that ideology, a lot of white people will discover that it doesn't include them.
Right.
And so as soon as they recognize that this is a threat to humanity as we understand it in all of our diversity, you can't be a situation can't be a threat to one sector of humanity and not be a threat to the other.
That's right.
And so that's how they have to see it.
Alice, your thoughts?
Thank you. And, Maysa, I was probably 8 or 9 years old lived in New Jersey during the riots, and the National Guard was in residence in my town. And I was alive in the 70s, during various times. And I was thinking while you were talking, Jerry, I think that ability of self-reflection is like so incredibly important. But, my dad is not alive now, but if he was a caricature, Archie Bunker would be that caricature. And so, unfortunately, 40 years ago, when this, this has been going on for hundreds and hundreds of years, but we didn't get it. The white people didn't get it. They just sort of made a joke of it or allowed this undercurrent of white nationalism to be alive and not challenge it. And I remember as a kid, it was really hard to talk to my father and to tell him, hey, you're wrong, and I did, and I fought with him all the time, but it was, it was really hard. And it's even harder now because, the fear, I think, Jerry, what you said, it's not only the fear of what I'm afraid of in the other, but I'm afraid to say the wrong thing, right? I am, in a position as a white woman in this privilege to misspeak and be misunderstood, and yet need to continue to talk and take responsibility of all the things over the last 40 years that I allowed myself to get away with, if you will. So it's a complicated time, but I hope you started at the beginning of the conversation. It's a second order change. This physics is not. This is not just change. This is really second order change that has to occur. And now is the time for us to eradicate this racism and inequity that exists in our country. And if this isn't the time to do it, I can't think of another time and another opportunity. So,
yeah. Thank you, Alice.
But I think COVID is also symbolic of, maybe even more than symbolic of it's a public health medical issue, obviously, but it's also symbolic, as you started out, Maysa, saying it's symbolic of racism itself as well. And so while the world is aware of COVID, it has to become equally aware of how racism is also a kind of COVID.
Right.
And that it's affecting everybody, and it's a pandemic, it's affecting everybody. And the moment you start thinking that racism is only somebody else's problem, that's when you become even more vulnerable to its potential destruction and impact. That's
right. So I'm going to start with the first question, which actually piggybacks right off of what we were talking about. And the question, Christina, do you want to moderate the questions and then we can all answer?
Sure.
Okay. Sure. Awesome.
I'm going to pick. There's a list of questions here, and this, I'll just say, this is a very powerful and informative conversation. The first question I'll pick is one that is very connected to the conversation you're just having. And that question is, why do we always look at helping people of color? What is the thinking in the mental health profession about the pathology embodied in privilege that is never examined or acknowledged as being present? It feels like a single lens approach when it clearly is much larger.
Yeah, if I can tackle that.
Yes.
So something that I've been working on, a project that I've been working on for the past few months is publishing a book that's specifically going to outline the process of allyship. And in this book, one of the areas that I tackle is breaking down the pathology of privilege, where it came from historically, how the construct of race got created and perpetuates privilege and remains, maintains a society where by virtue of the construction of race, you are able to have the entitlement of that privilege. But then it also offers, true stories around the path for acknowledgement and understanding for white citizens that are prepared to pursue racial justice, not lead the fight, but certainly walk in the fight. And then it allows for a framework for which they can begin to identify the process of allyship. I think what happens is that there's a sort of commonality in terms of terms. People throw around what allyship means, but there are different variations of that allyship. And so if we define ourselves as, if we can define ourselves correctly and create a structure within that definition, then we can stay that lane, but then we can also look at what the other areas of allyship are and how to potentially develop into those areas if we want to. Right. And my challenge in the book is to say, look, if you want to be an ally and you want to pursue racial justice and you're just, you've identified through these sort of characteristics that you're just a supporter and you want to remain a supporter, then do that. But don't show up in the world saying that you're an equity broker or an accomplice if where you sit is as a supporter, because then you won't be authentic, right? And so there is a process, I think, that needs to happen in unpacking that. There are other authors who have tried to do this in different kinds of ways, and I'm hoping that this will contribute to that body of literature and support folks. And while this was not going to come out until the fall, now we have a new publishing date of July. Let's see what happens if that can occur.
It's a wonderful, wonderful framework. It reminds me of the importance of the kind of psychic surgery that such a framework is challenging people to have, and the kind of soul searching that one needs to do to see how we are actually living out of deception ideas about ourselves and others. People are quick to quote, and I'll do it as well. Dr. King's statement about either we learn to live together as brothers and sisters or we perish together as fools. But in order to see ourselves as brothers and sisters, something has to happen to the way we think about our relatedness to one another. And that impacts the way we see ourselves and the way we see other people. And like you just said, Maysa, if you are in a position and you want to be supportive, but yet you're in a structure that further perpetuates the oppression, somehow or another, you've got to become aware of that conflict and that contradiction and make a decision how you're going to resolve it, hopefully for the better of all humanity.
Thank you. Alice, did you want to address that question? If not, I have another special question for you.
Just a quick statement is I do believe that the traditional models of psychotherapy perpetuate this privileged model, from psychoanalysis to across the board. And you'll be like, why is she saying that? Because she runs a mental health agency. But I really do feel that this idea of 1 hour sessions is a very privileged assumption, and that no one needs. The reason why we think people need to get fixed is because we have to give them a DSM code, and then we have to bill through this, and this whole system needs to be blown up, and we need to find another way to connect and promote attachment and be attached and learn from each other. So,
and one of the interesting things about that, Alice, is that efforts have been going on like that in communities of color for a long time. It's just not as necessarily as visible. Not that more needs to be done. More needs to be done. In fact, Ralph Ellison helped to form a mental health clinic in Harlem in 1942, and was involved in he raised the question, what value did psychoanalysis have for Black people? And so there are a lot of indigenous, if you will, resources. All communities are not totally resource-less. And I try to help people to identify what's already their self-healing capacity through culture, through tradition, through understandings of their faith, if they are faith-oriented, and to remind them that those communities have a lot to teach the wider mental health community as well. There needs, as you said, Alice, I totally agree, a new partnership, a new paradigm, a new way of thinking of what constitutes mental well-being and support of mental health.
Well, and I think if I can add just 2 more things, sorry, Christina, to that, is that, if we look at the origin of the development of the field of psychology, it was never meant for people of color, despite they were, folks of color, and particularly the dark history that the U.S. has with African Americans. That no one thought that was that the inhumane treatment that has happened for centuries was considered, treatment worthy, right? Instead, it was pathologized. Severely pathologized. And so, the traditional forms were grounded on sort of like this, perpetuating sort of the same structural racist mentality. I think the other thing I want to say to that is that we have stayed away as a field from looking at racism itself as a pathological construct that we probably need to unpack, right? Because if you think about what it takes in order to operate from that level of mentality and the sociopathic, antisocial, arena that sort of enters into, that is something that needs to be examined, of which we've stayed away from, and while earlier versions of DSM pathologized, sexuality, this has never been something, that has been considered by the body of the DSM in terms of evaluation, right. And treatment for, right? It's not just diagnosing it; it's then treating it,
which has led the Black community historically to be suspicious of
right.
mental health treatment in those forms, as well as the larger healthcare healthcare system, you know.
And responsible as the receivers.
That's right.
Right?
That's
Not
right.
as the victim, not the perpetrator. So,
Right.
right? Like that's an incredibly complex dynamic that we have not, you know, peeled back the layers on.
Right.
So how do we help folks that practice, you know, from this mentality, engage in their own healing,
right.
you know, and reconcile that? Yeah.
You remember the feeling, the notion that a slave that wanted to run away was mentally ill, and there's an actual clinical term, drapetomania, that a slave wanting to run to freedom was considered to not be healthy. That it was a good, you know, how could you leave a secure, supportive environment, quote unquote.
This is really an incredibly, as I said before, powerful and informative conversation. I do want to honor some of the questions in the Q&A and ask one more question. I'll ask specifically to Alice first, and then if each of you could end by sharing with us what your call to action would be for the community and for the people on the call. So Alice, we're getting in the chat, there's several questions about children. And people are concerned about the impact that this has all had on children who are being isolated from school and being taught now to be socially distant. And on top of that, we're in a time where people want social connection more than ever. And I'm wondering if you could say a little bit about how you're seeing that manifested in the children that you work with, and what do we do to help these children?
Alice, unmute.
Yeah, I know. I'm having a sound problem today. I want to say that every single person in the child serving community is really worried about this. The way that I don't like the way this comes out is no one has eyes on our kids. And that really actually has a double meaning that I don't like, right? Is that our kids, if they're not seen by the white folks, then they're not, you know, okay. So there's that interpretation of that comment. But on the other hand, you know, our kids our families are in such economic and, you know, social distress where, you know, in one room or two bedrooms or one bedroom, you know, they've been living together and it's been very difficult. And it's, so I think that we are working really hard in New Haven community across the state to make sure that we're thinking about all of the various systems that they come at our kids in a different way. I was on the phone with someone from DCF today and they were talking about, you know, they go out with cops, right? And so how do they begin to look at their practice and changing it? So I don't think any of us have an answer. I believe that we have to be outside. Parks are opening, the Park and Rec is opening. We're sending our clinicians there. We want to be available, you know, sitting on a bench, you know, to talk to a parent, you know, really begin to actually be on the streets and be available. You know, that's what I hope that we can get to an agreement going forward.
Thank you. And how about we could start with you in terms of what would your call to action be for the audience here listening today?
You talking to Alice?
Yeah. I know she's having
can you
an
repeat
audio
the question,
problem.
Christina? I'm sorry, I heard it off.
What would your call to action be for the audience listening today?
My answer would be with your kids. I mean, in some ways, our opportunity to be in our home and to be close to our children and to not stress out that they aren't doing what they're supposed to be doing, but to actually use this time to have some conversations with them and to really connect with your kids. And, you know, so for folks who are at home with their children to make sure that they're doing okay themselves so that they can be there for their kids. And I think the call for action is we have to examine every single practice now and rethink which direction we're going to go when we reopen. We have that opportunity to actually change and let it happen now. Where else and when else would it ever happen? So
thank you.
look at it.
Jerry?
I'm a part of a committee of some community leaders, and we're struggling to answer and look at three questions in which can be, and we hope that we'll have an agenda for call to action. One, how do we help to increase and build the trust of the Black community to the healthcare system? How can we help people to feel that they can trust the healthcare system? The second question is how do we then give them providing information about how to access healthcare systems, and to have some way of having people accompanying them in that process, a kind of advocacy for negotiating and dealing with healthcare systems. And the third is a significant outreach centered around talking to people about what it means to advocate for self-care, and not just social action, but to really think about and promote the self-care capacity of people in our community. So those are the three areas that we're attempting to address: building trust, accessibility, and negotiating healthcare systems, and advocating for people's understanding of self-care.
Thank you. And before I ask Maysa for her call to action, which we will close on, I do want to thank the audience and let everyone know that when the session ends, you'll be prompted to complete an evaluation, which is really important to us as we plan future sessions. And you will get a follow-up email with a link to the recording of the webinar and some follow-up. I'm sorry we didn't get to all of the questions. There's some good questions in the Q&A, but maybe we can follow up with the panelists and share some of those responses in our follow-up email. Maysa, let's end on your call to action for the group.
Absolutely. For me, the biggest call to action is helping folks understand that mental and physical health are inextricably linked. They're not separated. They don't operate, apart from one another, and that we have to take this opportunity as a chance to take care of both our physical and mental health. By doing that, we can connect and create both a virtual village and a safe social distancing village where we're connecting on our suffering, our pain, but our happiness and our joy can happen all simultaneously. I've been wrestling with the idea that good and bad can happen all at the same time. And perhaps, we can contemplate that as well. And the last thing is finding a productive outlet. Sometimes we ignore the thought that we need to find those productive outlets. And for some, it might be exercise. For some, it might be meditation. And for others, it may be engaging in what feels right to change the world. So those are my areas of action, immediate action that I think are logical steps that can be taken.
Thank you so much, Maysa. And thank you, Jerry and Alice, for giving us your time today. This was really, as I will say again, a powerful and informative conversation. And thank you all for the important work you're doing. And thank you to everyone on the line.
Thank you.
Thank you.
Bye, everybody. Are we off? Thank you, Jerry.